For this meeting has begun.
Good afternoon, everyone. Let's go ahead and begin our webinar. Welcome to the webinar today on the U.S. Department of Veteran Affairs Mobile Adult Health Care Program facilitated by the National Alzheimer's and Dementia Resource Center, which consists of our team at RTI International. I'm Siri Schumann with the Resource Center, and I will be moderating our webinar this afternoon. The purpose of these webinars is to provide helpful, current, and applicable information for ADSSP and ADI-SSS grant projects and others in the Aging Network. Please note the webinar today is being recorded, and the PowerPoint presentation will be sent soon after the webinar. We will allow time for questions through the webinar's chat feature at the conclusion of the presentation. If you have a question during or after the presentation, please enter your question into the chat feature of the webinar. At this time, I'd like to turn it over to Erin Long from the Administration on Aging, Administration for Community Living, to provide a brief welcome.
Hi, everyone. I would like to thank you for taking the time out of your day to learn about the Veterans Administration's Mobile Day program. I want to thank Karen Massey and Karen Elechko for spending their time with us to help us learn about this valuable resource. We look forward to hearing what you have to say, and with that, I will just pass it back to Siri.
Thanks so much, Erin. Today, as Erin mentioned, we'll hear from Karen Massey and Karen Elechko. Karen Massey is the Chief of Strategic and Transformational Initiatives for Geriatrics and Extended Care in the VA Central Office. She has 36 years of experience working in the VHA, including direct patient care, medical care cost recovery, and the decision support system. She's based in her home office in New Jersey, where her family includes 3 geriatric dogs, a Weimaraner, her best friend, a Labrador, and a wobbly 15-year-old toothless, mostly blind and deaf mini dachshund who is appropriately named Diva. Karen Elechko is a registered nurse in an expanded role who works in the Golden Memory Dementia Clinic. She created, designed, and implemented the Mobile Adult Day healthcare program that serves veterans with memory, safety, strength, and recreational activities at the Veteran Service Organization locations in Chester, Delaware, and Montgomery counties in Pennsylvania. She is also a member of the Alzheimer's Association International Society to advance Alzheimer's research and treatment. Karen, I will turn things over to you. You can get started as soon as your slides.
Thank you very much. This is Karen Massey, and I want to thank you so much for this opportunity to talk about the Mobile Veteran Program, which is a Mobile Adult Day healthcare program. The program began in Canandaigua as part of our innovative T21 initiatives, and Karen Elechko has expanded that model to Coatesville very, very successfully, and she will be presenting the information now about the program. So, Karen.
Thank you, Karen, and thank you for having us today to share our program. Hello and welcome to the webinar presentation on our Mobile Veterans Program. We would like to begin by acknowledging all the veterans participating in this webinar. Thank you for serving our country. We appreciate you. We are here at the VA to serve you now. The Coatesville VA Medical Center sends a team of VA care clinicians to 5 local American Legions and/or Veterans of Foreign War posts out in the community. Our program occurs at one site per day from 10 a.m. until 2 p.m. Coatesville has a team of 4 who provide care at these sites with a maximum enrollment of 20 veterans per site. The approach is cost-effective and self-sustaining for future years and helps the elderly and injured veterans to benefit from structured care in an informal environment. This community care-based mobile health strategy reduces distance barriers, improves access to care and compliance with care, and provides support to family caregivers as well as empowering veterans to remain independent and home-based. So we're going to go to our next slide and explain one veteran story. This is a 67-year-old male United States Air Force Vietnam veteran with a medical history of bipolar disorder, dementia, nicotine and cocaine use, chronic obstructive pulmonary disease, decreased hearing and vision, and 2 recent suicide attempts in February and March. He was referred to our program by his VA primary care provider through his mental health intensive care manager. She had contacted me on the phone and asked me to do a review of his chart and see about his appropriateness for the program. And after a review, I thought that the program would really benefit this veteran. So she asked if I would speak to him one-to-one with her there as well and explain the program to try to buy his interest. We did have a conversation. He said, well, I'm too young for this kind of program, and I'm, I most likely will be one of the younger veterans in the program. And I said, you may be, but I know you definitely are not the very youngest. We have others that are younger, and really this is a program to help our veterans stay in the community, and you can even just observe the program and give us your observations on how we can improve the quality of the program after observing. You don't have to enroll in it indefinitely. So he agreed. This veteran also, he does live at home alone. He doesn't have any caregiver. So recently he spent a day observing the program. And after the observation, I questioned him and asked him about his satisfaction of the program and his observations of how we can improve. And he looked at me. We just had the one-to-one conversation, but he raised his voice so that everybody that was at the program participating could hear. And he said, Karen, a few months ago, I had plans. My plans failed. I'm very happy I failed in my plans because I now have a meaning for living. Yes, I love the program. I will return, and I don't have any recommendations of changes. So since his enrollment, we've seen him evolve and we've seen him grow and see his mood changing in a positive aspect. And after some time participating in the program, he came back to the program and we saw a whole change in his personality. The staff asked him and said, what happened? You really look like something happened in your life. And he expressed to the team and all the veterans there that his friend had committed suicide the night before, and he only wished that he could have helped him and reached out to him and get him the help that he needed, as in the help that he's receiving. So the whole team, we immediately called his provider, his care manager. We got everybody involved to help him through this difficult time. And the amazing thing, besides the strong and supportive staff, the veterans that were participating in the program helped to support him through this difficult time. Since then, he continues to come back. He participates really well in the program, and he's resolved those issues of sadness and depression, losing his friend, and he has not had any thoughts or talks of suicide or any kind of ideation for suicide thoughts. So that's our first veteran story of how he got involved into this program and how it has made an impact on his life. Next, we're going to go to a second story about a 70-year-old male United States Vietnam veteran. with a medical history of vascular dementia, nicotine use, alcohol abuse, chronic obstructive pulmonary disease, type 2 diabetes, exposure to Agent Orange, hyperlipidemia, and macular degeneration. This veteran was not a participating veteran in our Mobile Veterans Program. What had happened was at the post, the office manager came running in to the VA staff and said, "I need a nurse out in the parking lot. There's a veteran who is bleeding from his head. He has a head wound. And can somebody come out because he's refusing for us to call 911. He will not let us call." So we have a licensed practical nurse on the team. She ran out to the vehicle with her supplies. She gently provided first aid to this veteran. She noticed when she was cleaning his face that he had a wound over the left side of his forehead down to his eye. So she gently applied first aid, cleaning him and speaking softly and calmly and caringly and in a relaxed manner. She recommended to him the importance of seeking medical treatment now as in a hospital emergency room setting. With her calming, her relaxing, her supporting, and her caring attitude, he finally agreed. Another staff member called 911. The third staff member was in the program, maintaining the program with all of the situation occurring in the parking lot and keeping all the veterans inside calm. And the medics arrived. The licensed practical nurse, she gave a handoff communication to the medics of what she found when she found this gentleman. So as it turns out, he went to the hospital, he received treatments, he received multiple sutures in the area to close the head wound, and he was examined and evaluated. The staff immediately contacted his VA primary care provider to explain the situation and the need of a follow-up appointment after his emergency room visit. He did get an appointment. He saw his provider, and his VA provider is the one who removed the sutures when it was time to have them removed. So the veteran's outcomes. The veteran came back to the program, thanked all the staff for helping him out, and he opened up to the staff, explained that he believes he had the head injury from falling out of his bed, hitting a bedside bureau, and causing a laceration on his head. He thinks he was drinking too much, and he wanted to join the program. His outcome is that not only did he join our program and is coming weekly, he also joined other community programs as an AA, and he's receiving multiple supportive services. He's mending his relationships, with his broken relationships with his family, and he's well kept, he has a content mood, and he seems like a different man from the first time the staff had met him. So that is his outcome, and like I said, he continues to join and he loves the program. Now with that being said, we have our staff's outcome. Our staff's outcome, they were submitted for our hospital for a Coin of Excellence Award, and this is for staff at our hospital who take immediate action whereby such action results in a favorable outcome for our facility, and that such duties are above the normal requirements of the said job description and responsibility. This gentleman really wasn't in our program. They asked for help, and the staff came out running to help this veteran in need. So to the left of the photo is our LPN, our licensed practical nurse. That's Adrienne Watkins. Next to her is Lisa Wilson. Next to her is Amber Hauer, and she's our recreation therapist. And on the right is our hospital director, Mr. Gary Devansky. So that is our second veteran story. Access to care. Our VA Mobile Veterans Program is a hybrid of an adult day health care program. It's a collaborative partnership between VA medical centers and local veteran service organizations that increases access to care by providing services in the community near the veteran's home. This is our Secretary's number one priority. Secretary Bob McDonald, his number one priority is getting access to care in the community for our veterans. So the veterans are, like I said, are very satisfied with this program. We are their facilitator, it seems, with their VA providers. When they need something, we communicate with them, their providers immediately, and we're able to get what they need when they need it while they're living at home. Okay, here's some of the things we offer in this program. We offer individual plan of care. We offer, as I said earlier, coordination with our VA primary aligned care teams or PAC teams. We offer care management. We offer therapeutic exercise, including coping strategies, accepting help, taking care of yourself, and reducing stress. We offer many leisure activities. We offer personal care, including hand hygiene. And today is, as we all know, it's May 5th, and today is the World Health Organization World Hand Hygiene Day. So remember, clean hands count for safe health care. That's my nursing piece. We're always trying to maintain our veterans' health and well-being and preventing infections. So one day a month, what we do is we give the veterans a mini manicure, basically. So they soak their hands in a warm soapy solution, and we trim their nails and file their nails. And they go home, their families, their caregivers have told us that that day we do hand care, they really sleep well that evening. We also provide nutritious and regular snacks as well as sugar-free snacks for the veterans. We provide caregiver support for the veterans' caregiver, education. We provide dementia care education and respite time for the caregiver. Some special features that we've been able to offer in the last year are we had our hospital's respiratory therapist come in, and she provided lung health for the veterans. That's including veterans who have CPAP machines and who have a diagnosis of sleep apnea, and smoking cessation thoughts and trying to encourage them to stop smoking. We also had a dietitian who came in from the hospital, and she provided diabetic education for veterans, as well as she ended with nutritious smoothies for the veterans, and they really enjoyed that. Another, what we're having this month, which is going to be interesting, a nice change for the veterans, we're having two pharmacy residents coming in, and they're going to provide education to the veterans who are participating in the program regarding diabetic education with considerations to diet, exercise, medication administration, checking blood sugars, and medication adherence, important drug-to-drug and drug-to-food interactions, and how to properly dispose of medications. So we're always looking for new ways to educate our veterans and keep them home and healthy. We have, at all of these, we have to take into consideration safety, and we have a safe, supportive environment for our veterans. All sites of care are Veteran Service Organizations or VFWs or American Legions. They're centralizedly located in our catchment area. They have ample parking and are ADA compliant with easy accessibility to public transportation. The sites of care are inspected yearly and based on the requirements of the Chapter 17 in the most current edition of the National Fire Protection Association Life Safety Code, which includes monthly safe environment inspections, and we conduct also monthly fire drills with the veterans. This is our team, and this is why I said it's basically a hybrid of adult daycare. We have a recreation therapist. It consists of, basically 4 employees, a recreation therapist, a licensed practical nurse, a certified nursing assistant, and a nurse coordinator. Other resources supplied by the VA are a van for the staff to travel to the site of care, activity supplies, incontinence supplies, and bagged lunches. We also have, the team has received various staff competencies to take care of this patient population. Some of the competencies that they have received is knowledge of memory loss disorders, understanding behaviors, validation therapy to manage difficult behaviors, strategies for daily care, mealtime and eating, dementia safety, and that's including driving, firearms, medications, and falls, meaningful activities, caregiver self-care, because we do communicate with the veteran's primary caregiver all the time, and at each site they have an annual verification competency about the facility's safety. So they have to know where the important things are, as in the telephone, if they have a telephone, the fire extinguishers and the exits and the exit signs have to be lit. So these are all the safety aspects that the team learns before they go out into the field. One other portion that I would like to add to this team that it was unintentionally missed are volunteers. We have volunteers at some of the sites. We don't have them at all, but we're working on getting more volunteers. We have at one site 4 volunteers to accommodate the needs of the veterans, and most of the other sites have 1. One site doesn't have any volunteers, and like I said, we're working on that because those people with dementia frequently have to have one-to-one type activities to keep them engaged in programming. So we really appreciate our volunteers, and they really help us out an awful lot during programming time. Here's our program history. It was initiated by the Canandaigua, New York VA Medical Center in 2011. The initial funding was provided through a competitive peer review grant from the Geriatrics and Extended Care Non-Institutional Long-Term Care Sub-Initiative of New Models of Care as part of the VA transformation to the 21st century. That site received the 2011 New York Organization of Nurse Executives Best Practice Award. It was later expanded to us here at the Coatesville VA Medical Center in 2014. At that time, the veterans who were enrolled in the program, they did not care for the names, so they selected 3 names, and all the veterans voted on changing the name to VA MVP, or Veterans Affairs Mobile Veterans Program. And that was effective in September 2015, the name change of our program here in Coatesville. Our current program in Canandaigua exists at Canandaigua and the Coatesville area. The veterans have rated the program very highly in satisfaction. Our Coatesville Mobile Veterans Program achieved the following recognitions. The Joint Commission identified it as a leading practice. It was nominated for the Rosalinda Gilbert Innovations in Alzheimer's Disease Caregiving Legacy Award. It was nominated for the Hearst Health Prize for Excellence in Population Health, and it received honorable mention on the VHA Pulse Promising Practice, and it's included in the Undersecretary's book, The Best Care Everywhere. Here's some preliminary demographics of our participants in their war era, and our highest population in the program are Korean veterans at 33%, and then our next would be 28% are Vietnam-era veterans, and then it goes to World War II veterans at 20%, and then post-Korea at 11%, and Persian Gulf and pre-Korea at 3% each. Additional preliminary demographics of their branch of service are, we have number one, the Army at 57%, the Navy at 24%, Marine Corps at 8%, Air Force at 9%, Marine Corps at 8%, and Coast Guard at 1%. We have 145 men enrolled in the program and 6 women. The age range is from 54 years old to 101 years old. Some additional demographics include the patient's diagnosis. This has been really interesting for us at our facility and probably other VA facilities. Our veterans problems list can span from 8 problems up to 88 in this group that are attending the program. So what we did, we kind of brought them down and tried to individualize them to the list that's on the screen right now, as with stress disorder, dementia, diabetes, depression, lipid disorder, hypertension, and coronary artery disease. As you can see, the lipid disorder is the highest, and then hypertension, followed by dementia and the coronary artery disease. As you know, the research shows that some of the risk factors for cognitive impairment includes hyperlipidemia and hypertension and coronary artery disease. So many of those veterans have not yet been diagnosed with dementia, but they may be in the future. So we're going to be monitoring that to see if that does happen. We have found this program to be a win-win situation for our veterans, our caregivers, our veteran service organizations, and the VA, as well as the dedicated staff. The VA Mobile Veterans Program has been successful in numerous areas that directly and indirectly benefit veterans and their caregivers through activities such as improving access to care, to support services in the community for veterans and their caregivers, increase veteran and caregiver scores for satisfaction, rebuilding of public trust through partnerships with our veteran service organizations, increasing the well-being and quality of life for veterans by empowering them to remain independent and home-based. And also, we've received unsolicited donations. This includes hot lunches at some of the posts that have an open and functioning kitchen. The veterans really enjoy that hot lunch rather than our bag lunches. And some of the posts who don't have a fully functional kitchen, they'll donate takeout lunch once a month for the veterans as a treat. Other unsolicited donations, down at one of the posts, the beautician down the street heard what we were doing. She came in, introduced herself, and she asked if she can donate once a month hair trimming for the veterans. So she comes in once a month at one site and trims the veterans' hairs. That usually we coincide it with the hand hygiene day. So it's kind of like a mini spa day for the veterans, and they just love it. We also have received some cash donations to help support the program in buying supplies, snacks or activities for the veterans. And it's been, the veterans have been, like I said, loving every portion of the program, as well as the caregivers. They can't tell us enough how much they appreciate that respite time for them. Right here, this is a photograph of our Veterans Day 2015 that took place, our parade here. We had the veterans fully involved in it. They created and cut out the stars for our van, and they created the posters on the van. And some of the veterans were at the parade, and we celebrated them. They, since they changed the name to Mobile Veterans Program, which is MVP and Most Valuable Player, they all dressed up in their favorite sports uniform, and they either walked or rode in the parade with us. So that's just a photograph of the front of the van, and then here is a picture of the side. Each one of them, at each post, they created their theme, their sports theme or their local theme for the parade, and their posters were put on the van. So many of them you could see their name. There's Liberty Bell because we're in the suburbs of Philadelphia. There are Eagles, so they had a great time. This was a great activity for them. These are some of the things that we asked them, what does this program do for them? And they gave us one-word answers like confidence, pride, and they, like I said, are just loving this program. So some of our barriers and solutions, really our biggest barrier was finding safe sites of care. Many of the buildings were very old and may not be handicap accessible, but all the ones that we do have sites of care, they are handicap accessible. They're located within the community. They have ample parking, and they're easily accessible to public transportation. Some of our outcomes are that we have 151 unique veterans participating in the program. Veteran satisfaction is rated at 100% from very good to outstanding. The veterans also report that they would be just sitting at home doing nothing, and that they were happy and look forward to programming. Caregivers have reported their perception is that they're seeing an increase in socialization in their loved one and cognition and functional status of their loved one. Of the cumulative total of veterans enrolled in this program, one veteran was institutionalized for long-term care antibiotics, and so we prevented institutionalization by 98.9%. At this time, each site is visited once a week, and veterans have requested 2 days of programming at each site. We've also seen a decrease in the primary caregiver's burden. Just going back to the top of that slide, of the 151 unique veterans, we currently have, those were ones that have been enrolled in the program, but we have 88 of them who are totally involved and enrolled and actively participating in the program. I'm going to just give a little bit of information about caregiver support, and I'll give you a caregiver support story as well. Our Mobile Veterans Program systematically reviews through education with the veterans caregivers problems including dementia with psychiatric symptoms, personality changes, behavioral changes. It assists the veteran's caregiver in offering respite care while our veteran is receiving therapeutic socialization and recreation. Here's our veteran's caregiver story. We have a 77-year-old post-Korea Army veteran with a past medical history of multi-FARC dementia with depression and a very depressed mood. He has a seizure disorder, type 2 diabetes, hyperlipidemia, hypertension, osteoarthritis, 2 cerebral vascular accidents, and colon cancer. This veteran was referred to us from his VA primary care provider, and they basically told us that his caregiver has called 911 on 3 occasions for physical and verbal abuse that he was doing to her. So we offered her all of our programs to help her and him, and one additional program is the caregiver or dementia caregiver support and education in the home. So we offered that to her while her husband was attending our mobile program. His wife was 72 years old. She has spinal stenosis, type 2 diabetes, and hypertension. So along with the caregiver education in the home and the respite care coming to the Mobile Veterans Program, her ZARA burden score decreased in 6 months from 11 out of a potential 16 to 5 out of 16. And this was a happy and significant drop of 6 points. In March, he was seen, and his geriatric depression scale, we use the geriatric depression scale, that's a high score. We use 15 points, and if they would be severely depressed if it was 15 out of 15. He scored 9 out of 15, and it indicated that he wasn't satisfied with life. He feels his life is empty. He feels bored, helpless, worthless, hopeless, does not feel full of energy, and feels that others are better off than he is. Recently, he came back to the clinic, had a repeat geriatric depression. Mind you, he's been involved in the mobile program for 6 months. His wife received home education and support and continued caregiver education and referred to caregiver support groups. His geriatric depression screen dropped 2 points. He ended up losing his feelings of being bored and hopeless after participating in the program. And it was really a great thing for both of them. They are doing so much better now. The potential, the reasons for calling 911 may have been related to a medical issue that was cropping up on him, and he did have a hospitalization for a short time. I would like to share 2 letters. One that the wife sent us on her ZARA burden interview that she wanted us to alert us about, and the second is a letter that he wrote to the veterans participating in the mobile program. So the first letter from his wife, the veteran's name too is George. So she writes, after she filled out her ZARA burden survey, she said, "It's important to note that the Tuesday Mobile Veterans Program has been wonderful. My spouse has been ill and missed a few weeks due to an illness. This definitely makes a difference in my week and allows me some free time. Also, your program and the activities are very well run, and George likes to come and looks forward to the program. Thank you for everything all of you do for us. Keep up the good work." The second letter, what we did, we asked the consent of the veteran's wife and the veteran if he would ever mind if we had the participating veterans who write him a get well card. So all the veterans wrote a get well card, and we VA staff put it in one envelope and mailed them all together to him. And the veteran writes, "Dear friends, thank you one and all for your caring thoughts and your lovely notes sent to me during my recent illness. I miss my friends and the great times we have at our VA sessions. I'm happy to be back today. I wish each of you good health and lots of fun." And I just thought that was a beautiful thing that I just wanted to share with you. Here are our referral sources and consults. We currently receive our consults from the Coastal VA Medical Center facilities, patient-aligned care teams, or PAC teams. We also receive them from our VA mental health clinics, from our geriatric and extended care services as in discharge from any community living center. We also receive them from our home-based primary care providers, our VA medical foster home program, and one of our fast and growing referral sources are word of mouth from the participating veterans in the Mobile Veterans Program to their comrades. These are a list of some recent non-VA presentations, and really the reason why we have them up here are for two reasons. One, partnership. We want to build partnerships and develop relationships so that we can share this program with everybody. As it turns out, last year it was presented at the Pennsylvania State VFW Annual Convention, and with that we were invited to the National Convention, VFW Convention, this July in Charlotte, North Carolina. Some of the other presentations, we wanted to share it with the Gerontological Society. There's a lot of people there, a lot of providers, to let them know that this is a program out there and available, and as well as the American Nurses Association. But primarily this slide is to help partner and develop relationships. Our future plans, changes, and improvements. We our ongoing partnership with our VA PAC teams, our home and community-based programming and community resources, ongoing assessment, formal and informal, of veterans' needs to live safely in the home and delay or prevent institutionalization. We're going to be starting up shortly video visits with veterans caregivers to continue our dementia care education and support in the home. And we would love to expand the program, offering a mentoring partnership and potential for startup fundings within the VA. So we also started this year a research protocol, and just briefly, we look at cognition of veterans all the time in the memory clinic. And I can give you an example of one veteran who is participating in the program, and this is from he's been participating for 6 months. He started coming to our VA in April of 2010. Our tool for measuring cognition is the St. Louis University Mental Status Exam, and in April of 2010, his score was 21 out of a potential 30. 30 being he would have a perfect score and answered all of the questions correctly. In March of 2014, he scored 15 out of 30, which is a 6-point drop. He started the program in June of 2015 and came back to the clinic in December of 2015. His score went up. His St. Louis University Mental Status Exam went up 2 points to 17 out of 30. So we're always looking at ways to improve through research, and we're just starting the research component of that now. And I believe that we're going to be able to publish a lot of research shortly. So I want to thank you for listening. And here's our contact information. I want to thank the RTI International for having us. And what are your questions?
Great. Thank you so much, Karen, for your presentation. We will move to the questions now. A few have come in while you were speaking, and some you answered during your presentation. Some are new. So just for the participants, as a reminder, you can enter your questions into the chat feature of the webinar. And one of the questions that came in a few times is, can you go over again all the locations where this MVP program is currently offered?
It's offered in Canandaigua, New York, and also here in Coatesville in our Coatesville VA Medical Center. We have 5 sites of care in our community here. One is in Delaware County in Folsom, Pennsylvania. We have another one in Downingtown, Pennsylvania, another one in Parksburg, Pennsylvania, another one in Spring City, Pennsylvania, and another one let's see. I think that let me see, I think there might be one more. One more site of ours is Westchester, Pennsylvania, Downingtown, Parksburg, Pennsylvania, Spring City, Pennsylvania, and Folsom, Pennsylvania. Canandaigua offers the program up there. They have it 4 days a week up in Canandaigua, New York. I'm not sure of their locations, but if you were to call the Canandaigua VA, they do have a person who is responsible and the director of the program that can let you know the sites up in Canandaigua, New York. Like I said earlier, we see the wonderful outcomes, and we are hoping that this program can be expanded to other VA locations across the country.
And a few questions came in asking about if there is an expansion plan in place currently to expand. A few in particular, someone asked about New York City, another person asked about New Jersey. I'm sure everyone's wondering if there's expansion plans in place or if this is something that folks out in the community or in the individual VA locations would maybe contact you about. What kind of information can you give people of how to find out about expansion opportunities?
Karen, do you want to start that answer?
Sure.
Hi, this is Karen Massey, and what we're trying to do is establish mentoring partnerships so that the expertise from the sites that have already implemented these programs can be shared with an expansion site. So indeed, contacting Karen Elechko to see if she would be willing to mentor your program would certainly be possible. I would suggest also copying me on it. We have very limited startup funding available, and we offer it to those who are interested in applying for a mentoring partnership. It's not a long application process, and it's usually based on the original proposal that the mentoring site submitted. So the mentor kind of submits it for you, and with a request for any kind of startup funding that may be sought to begin the program. So that's kind of the basis on it, but certainly to reach out to Karen Elechko and Karen Massey with our contact information on that slide if there is interest in expansion to other sites within VHA. I want to take a moment and also mention that I strongly feel that this is a program that could be done in local communities too. And I've reached out to a couple of people and places in a couple of communities where I live to see if they would be interested in starting this kind of thing up with volunteers to provide caregiver support in a community near where people live. I mean, that's beyond VA, but I think that it's something that we could consider trying to promote. Thank you.
Thanks so much. So quite a few other questions are coming in. Someone was asking about if you've looked at any outcomes associated with decreased emergency department use or unplanned hospitalizations.
What we do is we look at we have urgent care visits here, and I've been monitoring for our own hospital urgent care visits related to behavioral issues. And we have had, out of the 151, and over a 2-year span, we had 2 veterans who came to our urgent care, and it was one was having a major medical issue going on. The other veteran he reconnected with a son that he hadn't talked to for about 20 years, and he asked him to bring him here. But really, they weren't behavioral issues related to dementia. They were more related, like I said, the first one to a medical issue and the second one to a psychosocial issue. And but otherwise, we aren't monitoring in the community, urgent care or emergency room visits, because a lot of times we aren't made aware of them. And if we can open up those communications, that could be a great thing to monitor.
Hi, have we lost the connection, or they're talking on mute, maybe?
I think we might have lost Sari for a moment. We can go ahead and answer a few more questions while waiting for her return. There's quite a few questions about expanding this program to other sites or states.
Hopefully I kind of answered that, and for people who would like more information, they're welcome to reach out. Email is best usually, and can provide a little bit more detail or information if it's needed.
Yes, we have a full standard operating procedure for the program, and we really have wonderful brain activities for the veterans, or anybody. It doesn't have to be just veterans, that fully involve everything with the veterans. Basically, we have some veterans who are bilingual, and they're teaching us, easy languages, and the veterans who are at the program love it. The other activities, we do a lot of different kind of board games, as in Scrabble, and we read the newspaper, current events. We do a lot of creative arts type activities. Some of the veterans have instruments, and they do a presentation on their instrument for the group. It's really a lovely thing. One veteran, his St. Louis, mental exam is probably a score of 4 out of 30, but he can play a beautiful trombone, and he brings that in and he entertains the group. So we have, we're starting with technology too with the veterans. We talk about exercise within their limits, nutritious foods that they should be eating, the importance of socialization. All of the activities, we call them cranium crunches, and all of the activities that we create for the cranium crunches in the program are basically using their 5 senses. And we expand on that, because as long as we use our senses, then we can help maintain our brain and keep it functional as well, and keep our bodies functional. We also do chair yoga and Tai Chi in the program, and they also have a group. It's called exercise sittercise, they call it, and they do chair exercises. And then another exercise is dancing your worries away, and the veterans are doing dancing. A lot of times their spouse or caregivers come in early, and they participate in the program as well. Another way we're going to expand the program is we're hoping to have a caregiver support group at the end of the program. So then in a portion of the hall, we can have a support group, and the veterans will participate in the program. in another area. So these are all things that we're thinking about the future and trying to. I'm not sure if there's any more questions. But
we have questions on how your program's regulated and whether you have issues with states relative to service delivery and licensure.
We actually do not have a license. What we do, the only license that we do have is a revocable license with the site, so that we can use their site for those 4 hours. So it's government employees coming in using their space for 4 hours. But regarding licensures, they're thinking, since this is a hybrid new program, that we may be surveyed by Joint Commission and possibly CARF in the future. But that's, something that's going to be happening in the future. It's not today. But we probably will be surveyed shortly.
There's a question here about how you coexist with the other adult day programs in the areas that you're serving, if you have had any experiences with the other daycares in the community. How do you coexist?
We do have caregiver. We do have other programs in the community. One of the sites, in fact, have a lot of caregiver support education conferences. So some of our caregivers go to that during the time that the veterans are at our program. We have a lot of veterans in our area, and we have a lot of veterans who are attending the non-VA programs. So we do support them in the community, and they have, we haven't had any challenges or issues with any of the community programs, because what we found too, a lot of the community programs, our veterans that are participating in this program may have been discharged due to behavioral issues, but they are working in this program. So we really don't have, we coexist with them really well, and we also use them. It's just that sometimes they don't work out in a community program, but they work out really well in our program. It could be we're thinking that it's that camaraderie for the veterans being together. We're really not too sure, but that's something we could research. But we do pay for our veterans to attend the non-VA programs in the community as well. Like I said, we have a lot of veterans. In our program, like I said, there's 88 right now, but I think in our community programs we have well over 100 veterans that are attending community programs in our catchment area of our hospital that the VA is paying for.
Great. Thank you for clarifying that. So this has been wonderful, and we have actually ended up with a lot of questions that haven't been answered, and we'll do our best to get some answers to some folks. Thank you so much for all your time and work, and I don't know about the other people, but I got lots of goosebumps while I was listening to the stories. They always help really paint such an amazing picture. So thank you for your time, for putting the presentation together and sharing this. We definitely, based on the comments, have a lot of people want to know more. So we always find that exciting with our webinars. So it's 4 o'clock. We're going to close things up now. If we have Sari Schumann and my Erin Long's contact information in the discussion note box. If you have any questions about the presentations or comments about the presentations, please contact either Sari or I. And I think that the presentation, everybody that was registered will be receiving a copy of the presentation. So thanks again, and I hope everyone has a nice afternoon.
Thank you. Thanks for the participation.
Yes, thank you so much.